Welfare is a very important part of Labour's agenda, and we look at it in a number of ways. We believe that the current welfare system isn't working. The Tories have introduced a very cruel system of disability work assessments for disabled people, and the stories that have come out of it are heartrending. Now, in one of my previous jobs, I did help disabled people to get into work and make the adjustments to enable them to stay in work and progress their careers. So, of course, the aim is a good one, but how you do it is really important, and that's where it's gone wrong. Threatening people with withdrawing their benefits rather than helping them and joining up with employers, which would be a far better way of doing it. And that's the way that Labour would do it. That's the Labour way. I feel very passionately about social care. My mother had dementia and she lived in a care home for the last 2 or 3 years of her life, and the experiences we had were very mixed, some good, some bad, and some downright ugly. So I feel strongly about this. That's why Labour is looking at how this affects elderly people, in particular the way that people who've worked all their lives, paid taxes all their lives, suddenly have to run down their savings to pay for care quite often. We don't believe that's acceptable, so that's why one of our flagship policies is to introduce free personal care for adults in England, to mirror what already goes on in Scotland. So we know it can be done. We believe that that will help old people, it will enable them to receive care with dignity, but we will clearly need to go beyond that. It's clear that the current system of social care, which is very fragmented, isn't working. There are lots of small care homes, there are lots of small care providers. It's not particularly well policed by the Care Quality Commission. So we need to look at that again, and Labour proposes to introduce a national care service which will work alongside the National Health Service to ensure that people get continuous care when they need it the most. And you'll see more state involvement in that. You'll see the state helping people to live better lives when they're older and vulnerable.